Hi, David Eastman here with Eastman Estate Planning, and today we're going to do a quick video on the 4 documents that everybody should have. If you're over the age of 18, everybody should have these. Very, very important, especially with COVID and quarantining and doctors and all that kind of stuff. So we want to make sure that anybody that's over the age of 18 has these 4 documents. If you're under the age of 18, so let's say I have a child that's 15, 16 years old, I don't need to have these documents for them because I'm already the guardian of this person, and so I can make their medical decisions and get information about them. But once they turn 18, then they're considered an adult, and now if I want to know what hospital room number they're in, what condition they're in, what medications are being given, who their doctor is, I need to be an agent on their healthcare documents, and so you need to have these 4 documents for them. So some of you clients may have some children that are going off to college, or maybe have grandchildren that are getting ready to start college here in the next little bit. A good going away college present, believe it or not, might be for legal documents that you haven't thought about. So the first one is the living will. What is a living will? A living will is the physician's directive. It just tells the doctors whether you do or do not wish to be kept on life support if you're found to be in a persistent vegetative state. So if we have a terminal condition, or if we're in a persistent vegetative state, the doctors need to know, do we want to be kept on life support, or do we wish to be removed from life support? And the living will is a document that's going to tell the doctors what you want to have happen. So very important we have that document in place. It also instructs the doctors if you just want to be kept comfortable. Do you want cardiopulmonary resuscitation? Do you want artificially administered food and fluids? Do you want to be kept in hospice care or home care? Those are all dealt with inside the living will document. So it's your first one. You need to have that one. The second one is called your healthcare power of attorney. So what is that? Well, your healthcare power of attorney is the legal document that says this is the person that I'm appointing to make all of my medical decisions if I can't make my own medical decisions. So if I'm incapacitated, I have COVID, I'm in a car accident, I'm unconscious, I need somebody to advocate my medical decisions for me, then I nominate that person inside my healthcare power of attorney. You usually want a primary person, so if you're married, it's usually your spouse, and then you'll have a backup or 2 or 3 alternates in place. One thing sometimes a lot of clients want to do is make it so there's co-agents on that. So if I have 2 kids, then sometimes they'll want to make it so their kids are joint or co-agents on the healthcare power of attorney. I don't advocate that. I recommend that you have 1 captain steering the ship at a time, instead of having 2 captains trying to steer the same ship, and then the ship doesn't go anywhere and we have lots of problems. So we want 1 agent at a time. You pick somebody that you trust, that you know is going to make good decisions for you, and then that person is in charge of all of your medical decisions. In addition to creating the document, you want to sit down with that person that you've nominated and talk to them about how you feel about certain things as far as medical procedures go. Are you an advocate of prolonging your life or not? Those are things you want to sit down with your healthcare agent and have a discussion about. And make sure they know that, what your wishes are. So that's your second. So you have your living will, you have your healthcare power of attorney, then your third document is your mental healthcare power of attorney. So in Arizona, we actually differentiate between healthcare and mental healthcare. And so you'd have your healthcare, but then you'd also have a separate document, which would be your mental healthcare, which deals with all the mental disorders that we suffer from, anxiety, depression, bipolar, schizophrenia, anything like that. If I decide, if I suffer from depression, I lock myself in my bathroom or something and threaten to commit suicide, and my wife needs to get me back on my medication to get me back the help I need, in order for her to commit me to this partial psychiatric hospitalization program to get me the help I need, she needs to be put on as my mental health care power of attorney. And then if she wasn't alive or available to do that, I would have a backup to her that could do that for me to make sure I get the help that I need for mental disorders. So that's your third document. And then your fourth and final healthcare document that everybody should have is your HIPAA form, which is the Health Insurance Portability and Accountability Act, or the Authorization to Disclose Protected Health Information form. And that just lets the hospitals and doctors know these are the people that have the authority to gain access to your medical information, so they can know what room number you're in at the hospital, what condition you're in, who the attending physician is, what medications they're giving you, what they're recommending as far as procedures go. That's all on your HIPAA form. And then on that, you don't have 1 at a time serving like we do on your healthcare power of attorney and your mental healthcare power of attorney. On that, we can list all 6 kids and your wife and Uncle John if you want to, and all of them then would have access to that information. They can't make decisions, they would just have access to information to know what's going on and how the hospital is treating you and whatnot, which is important, especially in today's world. If we get COVID, we're admitted to the hospital, we're in quarantine, then nobody gets to go to the hospital and see how you're doing or what's going on or how you're being treated. So it's very important we have that document so you can get that information and know what's going on. So those are your 4 documents. Hope that helps, and we'll see you next time.